This is a federal update. You can see Transport Minister Omar Alghabra there waiting in the wings, along with several other ministers lined up at the National Press Theatre in Ottawa this morning. This is all about an update on COVID-19, on the vaccine border measures, ArriveCAN, etc. We're going to be finding out exactly what is supposed to be happening. We do know, of course, that many of those measures were set to expire coming up on Friday here. So this news conference about to get underway in Ottawa, where, you know, as we've been hearing from Beatrice all morning, Jennifer, we're going to get some more specifics on what exactly the federal government has planned.
Right. No mention of whether or not masks will still be mandatory on places of transit, such as planes and trains yet. But if they do announce that the measures end, the change will mean that foreign nationals will no longer require that approved series of vaccinations in the country. So let's listen in now where officials are providing an update.
Including hand washing, wearing masks in poorly ventilated indoor or crowded settings, and staying home if you have symptoms to prevent spreading infection to others. À l'échelle nationale, le nombre de cas de COVID-19 par semaine a légèrement augmenté au cours de la dernière semaine. Ceci peut être un signe précoce d'une recrudescence. Il existe encore des variations régionales et certains indicateurs, comme les signaux dans les eaux usées, démontre également une recrudescence locale dans
water may indicate local resurgences in certain localities. Although the number of persons in intensive care remains low, it is dropping very slowly and remaining high in other cases, taking into account that we are spending more time in the fall indoors. We believe that there will be a continued rise in these figures. There is that risk. But our scorecard is very different from what existed a year ago. We have a point of view that is been driven by the light of what we have learned from vaccinations, and especially the bivalent vaccine that provides greater protection. We are aware of our vulnerabilities nonetheless, and we know that immune protection does decline over time. If you were infected or if you received your most recent vaccination 6 months ago or more, you are able to get a top-up of the booster. This keep your vaccination against COVID-19 up to date. This is particularly important for persons who have a greater risk of serious complications, and the bivalent vaccine is able to protect you against a variety of strains. To protect our health, we have to continue to protect our health on a daily basis according to our personal needs. For example, wash your hands, wear a mask in indoors spaces where there is poor ventilation or where there are a lot of people. We want to avoid infecting others. Thank you.
Merci beaucoup.
Thank you very much, Dr. New.
As you know, the Prime Minister will be updating you later this morning on our work to help Canadians in Atlantic Canada and in Quebec in the aftermath of Hurricane Fiona. Throughout this pandemic, our government has been focused on the advice of our public health experts, of doctors, with one objective in mind: keeping Canadians healthy and safe. As the pandemic evolves, so do our public health measures. Grâce aux efforts des Canadiens.
Thanks to the efforts by all Canadians, and in fact, the major majority of Canadians have stepped forward to get vaccinated. The situation in Canada has greatly improved, but there are challenges that remain, and we have to continue to be vigilant. We have to follow Dr. Tam and Dr. News and their team's recommendations. But we feel now that we can change our approach at the international borders at this time. My colleague, the Minister of Health, Jean-Yves Duclos, will be able to give you more details about that. Jean-Yves, you have the floor.
Bonjour à toutes.
Good morning, everyone.
Merci, Dominique.
Thank you, Dominique, for these remarks. I want to also thank my colleagues, Ministers Fortier, Algabra, Mendocino, and Dr. New, for being present with us this morning.
In the past, and as Dr. New just reminded us, we were and we are in a much better position today than we were in 2020. That is in large part due to the vaccination efforts of Canadians and to the observance of public health measures since the outbreak of the pandemic. Back in 2020, our government reacted quickly to the arrival of COVID-19, and we did not hesitate to commit direct federal funding to protect Canadians, which included $6 billion for PPE and medical equipment, $15 billion for vaccines and therapeutics, $5 billion for rapid tests and testing overall, $13 billion in other public health support, for a total of close to $75 billion in protecting the health and safety of Canadians. These investments allowed Canadians to access widely the tools needed to help slow the spread of COVID-19, including the vaccines and treatments needed to keep people from getting seriously ill. More than 85% of Canadians have received at least 2 doses of vaccines. All Canadians aged 6 months and older now have access to a safe and efficient vaccine. Further, fall booster vaccine campaigns have begun across the country, which will further increase protection. Moderna's new bivalent vaccine, which specifically targets Omicron, is now offered to all Canadians, adults everywhere in the country. Another good news is that 40% of Canadians say they want to receive a booster dose this fall, and another 40% are considering it. This is crucial. Modeling by the Public Health Agency of Canada indicates, for instance, that if Canada were to increase its rate of third doses from 60% to 90%, then it would also reduce by 90% the number of hospitalizations that we would otherwise see later this fall or early next year. Again, it is important that we stay up to date with our vaccination and get the booster shots that we are eligible to and protect themselves and those around us. As Dr. New said, immunity fades over time and a booster shot brings it back up. Immunity is like a phone battery. After some time, it needs to be recharged. So folks, if it's been more than 6 months since your last dose, it's time to recharge your battery and get a booster shot. High vaccination rates and Canadians' strong adherence to public health measures have helped push us to an enviable position. A recent study published by the Journal of the Canadian Medical Association reviewed Canada's COVID-19 response against a group of 10 comparable countries like Belgium, France, Germany, the United States, and Italy. The study found that most other countries had 2 to 3 times Canada's number of infections per capita. Our death rate was also the second lowest of the group, behind only Japan. Further to that, the modeling recently published by PHAC suggests that without public health measures or vaccination, Canada could have seen up to 2 million hospitalizations and 800,000 deaths since the start of COVID-19. That contrasts sharply to the much lower 150,000 hospitalizations and 40,000 deaths we have seen so far. 15 times fewer hospitalizations and 20 times fewer deaths. That is the outcome of Canadians having made the right choices during the pandemic. Permettez-moi maintenant de traiter.
Allow me now to deal with border measures. The Order in Council for that expires September 30th. These emergency measures were put in place to reduce the risk of bringing in or transmitting COVID-19 and its new variants. Our thought was always founded on prudence, carefulness, on the epidemiological situation abroad and others factors. Today, based on the data accumulated over the last few weeks, we are announcing that the government of Canada will not renew the order in council that expires on September 30th and will move all COVID-19 order requirements for all travelers entering Canada. This includes the removal of all federal testing, quarantines, isolation requirements, as well as the mandatory submission of health information in ArriveCAN.
Accumulated over the last few weeks and months. We are announcing that the Government of Canada will not renew the order in council that expires on September the 30th and will therefore remove all COVID-19 border requirements for all travelers entering Canada. This includes the removal of all federal testing, quarantine and isolation requirements, as well as the mandatory submission of health information in ArriveCAN. Le gouvernement canadien
The Government of Canada will maintain the ability to reestablish certain border measures, should they be required in the future, to protect Canadians from the importation of new variants of concern or other emerging public health threats.
That will maintain the ability to reestablish certain border measures, should they be required in the future, to protect Canadians from the importation of new variants of concern or other emerging public health threats. Les résultats des tests.
The results of border tests carried about at the Public Health Agency over the past months have indicated that importations of COVID cases and its variant no longer influence in a significant way the evolution of the pandemic in Canada. The higher level of cases of hospitalizations in Canada are largely explained by the domestic transmission of the virus and the rate of vaccination today. Allow me to say that Dr. Mona Niemer, the Chief Scientific Advisor, has set up a working group on long COVID, or post-COVID syndrome, as it is also known. The group will make a report this fall, and it will set up a framework to combat long COVID. It will outline ways of protecting the effects of long COVID. And the best way is to keep your shots up to date. Canada has always acted prudently with respect to COVID-19. Prudence will continue to guide our actions as a government over coming months. We see things will be critical because we're all moving indoors, and there will be more respiratory influences, including COVID.
Winter, we do expect an increase in COVID-19 cases and other respiratory viruses. Mais en restant à jour dans notre vaccination,
but by keeping our vaccinations up to date and by being careful, for example, wearing masks in certain circumstances, we will continue to protect our health, the health of those close to us, and the health of everyone.
All right, we've been listening to Federal Health Minister Jean-Yves Duclos announcing that as of October 1st, 2022, in 5 days' time, all the COVID-19 border measures will be no longer. That means no more ArriveCAN app, no more proof of vaccination, pre or on-arrival testing, no quarantine requirements or health checks. But the big one, Nick, is definitely the removal of the mandatory masking on planes and trains.
Absolutely, yeah, so that's coming off as well. So Friday was the last day. They're not renewing that order in council. This also applies to cruises as well. The government press release also saying that Canada appears to be past the peak of Omicron, BA4 and BA5, those waves. So that news breaking right here on CP24 Breakfast this morning. Effectively, all travel measures, precautions, etc., have all come off. So we'll be following that story throughout the day.
Back live to Ottawa, where Transport Canada and other ministers are announcing the removal of all existing travel requirements. Again, as of October 1st, no more proof of vaccination, on-arrival testing or pre-testing, or no more quarantining or isolation. Let's listen.
Double the total number of travelers we saw in all of 2021. And this is great news for the economy, for trade, for jobs, and for personal travel. And we want to keep that momentum going. So today, we're taking another significant step. As of October 1st, 2022, travelers entering Canada will no longer be required to use ArriveCAN in any mode of travel, air, land, or sea. This decision is as a result of the removal of all COVID-related health measures at our borders. Going forward, use of ArriveCAN will be optional, allowing travelers who so choose to submit their customs declaration in advance at major airports. Les voyageurs entrant au Canada ne seront
Travelers coming into Canada will no longer have to use ArriveCAN because of COVID-19 at our borders. We know that it will remain optional, that will allow travelers who want to submit their customs declarations in advance to do so.
ArriveCAN has been linked to mandatory health information, including vaccination status, that travelers have submitted when entering Canada. ArriveCAN will now become voluntary for those who want to save time at airports by uploading documents in advance. Alors que nous nous éloignons de la pire
While we are moving out of the worst phase of the pandemic, we are making it optional to accelerate the movement of people who choose to use this application, and that will allow our agents, our border agents, to concentrate on those travelers who may well present a higher risk.
is already available at Toronto Pearson, Vancouver, and Montreal Trudeau airports. In fact, 1/3 of travelers are currently taking advantage of it. In the coming months, we'll expand this option to be available at Calgary, Edmonton, Toronto City, Winnipeg, Halifax, Quebec City, and Ottawa airports. L'agence s'engage à continuer.
The agency pledges to continue this application by adding information to it that will be useful for travelers. During the pandemic, Canada has modernized its borders to make everybody's experience more efficient and agreeable and quicker.
Make crossing the border more efficient while never compromising the health and safety and security of Canadians. I want to thank our CBSA officers for everything they've done over the past 2.5 years. Grâce à votre excellent travail,
Thanks to your excellent work, you have been facilitating our economy and protecting our health.
thanks to you, we've emerged from this pandemic stronger than ever. And indeed, that is one of the main reasons why we've been able to take this important decision today. And with that, I will now pass the mic over to Minister Fortier.
Merci. Thank you, Minister Mendicino. Bon matin à toutes et à tous. Merci d'être avec nous aujourd'hui.
Thank you for being with us today.
The pandemic, the federal government has listened to doctors and science experts to make sound decisions and focus on protecting Canadians. Les politiques sanitaires.
Health policies change with a changing pandemic, and
who got us here today. It's Canadians who rolled up their sleeves to get vaccinated. You did your part. You got Canada to a better place with high vaccination rates and lower hospitalization rates and widely available vaccine boosters, rapid tests, and treatments. Les mesures frontalières qui ont été introduites.
Border measures that were introduced in the past were always considered as being temporary, like measures that were introduced at the time in the public service. Well, it has allowed our workers to continue working and has protected our communities and all Canadians.
Requirement last spring for public servants was based on the latest scientific evidence, and we will continue to follow Health Canada's advice to protect health and safety in our workplace. Pour terminer, je tiens à
To conclude, I would like to say that scientific data shows very clearly that vaccination is the most efficient and effective way of protecting all of us, our economy, and our country. We hope that you will keep your vaccinations up to date, that you will stay home if you get COVID, and that you continue to be masked if necessary.
Take your questions. On peut prendre la période des questions maintenant. Merci.
We can move into the question period now. Thank you.
We have quite a few questions, so I appreciate if you can answer them all. Of course, time is running, and I'm told that 9:30 is our deadline. So we will start with the questions on the floor. If you are on Zoom, please raise your hand with the raise hand function now, so we could take them after. Si vous êtes sur Zoom, vous pouvez utiliser la fonction.
If you're on Zoom, you can use the raise hand function, and we will go to Zoom after we take a few questions here in the room.
Houseman from Canadian Press.
I want to start by asking you about the Quarantine Act, COVID-19 cases.
We'll return to this live press conference from Ottawa once the question and answer section begins to take shape. And back live now to Ottawa, Dr. New and other officials are providing an update on COVID-19 border measures and mandates. Let's listen.
It's very clear that in a context where the context is very crowded and where there is poor ventilation, it would be advisable to continue to wear a mask. Annie Bergeron, Oliver, CTV.
Would you like to respond in English before I ask my question? Is that okay?
On this question?
Yes, please.
Now, as you heard from Dr. New, wearing a mask is still a very efficient way not only to protect ourselves, but protect others around us. And the strong recommendation that PHAC is making is for passengers on trains and on planes. And I think that Minister Alghabra, I'm speaking on behalf of Omar, but I think Omar, what I'm saying aligns with what you also are saying, is that this should still be a relatively easy measure to take to protect against COVID-19 infecting ourselves or infecting others. This being said, we're moving away from a coercive environment, which has created pressures and difficulties for air travelers and air workers in particular. Air workers have faced over the last few weeks. We have heard from the industry difficulties in making that coercive measure being followed by all travelers. So we believe that most travelers will continue to wear those masks, but there will be some travelers who will choose not to do so, and that's all right.
Thank you very much. My question is going to be for Dr. New as well as you, Minister Duclos. Last week, the U.S. president was quoted as saying, quote, "the pandemic is over." Today, the federal government is removing the last of the COVID-19 restrictions. Do you agree with his assessment?
And that's a fair question. The answer is that if anyone has doubts as to whether COVID-19 still exists, I would invite that person to visit a hospital anywhere in Canada. We have between 4,000 and 5,000 people hospitalized every day with COVID-19. That puts a very heavy burden on our hospital system. It's close to 10% of hospital capacity, which is currently used for looking after people with COVID-19. We also know that healthcare workers are very tired. They are exhausted, they have left in large numbers, and worryingly, many of them think of leaving in even larger numbers over the next months in Canada. We need to care for our healthcare workers if we want them to care for us. So we need to protect ourselves and to protect others by being vaccinated against COVID-19, taking advantage of this great new formulation for which we were one of the first countries in the world to have access to. And it's available everywhere in Canada. And we know that Canadians have done extremely well with 2 doses. We need to do, and we want to do equally well with being up to date in terms of vaccination. So I invite everyone, every Canadian listening to us, to do as well as we've done with 2 doses. And if we succeed in doing this, we'll reduce very significantly the burden on hospitals and importantly on healthcare workers, leading to the end of the fall and early winter.
It's a comment from me. Personally, what I would say is that I think we're past what we call the acute phase of the pandemic, but certainly the pandemic's not over. It'll be obviously the virus with us for quite some time, and I think that we need to continue to manage and as the virus continues to evolve. I think we should be optimistic. I think the Director General of the WHO also had a very optimistic message. Sort of the end is in sight, but we can't, as they say, you can use all the analogies you want. Take your foot off the gas pedal, or as a marathon, if you see the finishing line, you don't stop. You keep running even faster. So I think we want to be optimistic, but all of the tools at our disposal, we need to continue to push hard. Keep our vaccine coverage rates high. Keep up with your vaccination. Continue to wear, I would say, a mask in certain contexts. Certainly, if you're in indoor spaces with poor ventilation, if you're in crowded places. And I think as people go out, I recognize, and all of us, including myself, we want to go out and sort of have those social contacts. And I think people just need to be, as well thoughtful about the choices they make as they want to go out and reconnect with friends and family.
Back live to Ottawa, officials from the federal government providing an update on COVID-19 border measures.
Measures were not efficient in countering new variants. So how are you going to continue to fight against new variants and the introduction of new variants if that doesn't operate well? That is to say, border measures. We've heard, thank you. We've heard on some occasions and that the border measures do not stop the introduction of all variants. When variants change quickly, like is the case with Omicron throughout the country, there are many cases outside of the country. And that is where it is significant. We noted some weeks ago there was BA1, BA4, BA5 that have entered into Canada that are already present in Canada, though. And we had travelers coming into Canada who demonstrated that their infection was very similar to those who are already infected in Canada. So we, with respect to the transmission of COVID-19 in the country, have reached today's conclusions. Over the course of last week, we looked carefully at the situation. We look at the case of Omicron in December, and it can happen that if there are new variants that emerge, the Government of Canada may have to move to protect the health and safety of all Canadians, because it really is a social contract between government and its citizens to protect the health and security of its citizens. That is one of the major responsibilities of a government. So if it has to be done, we will do so. But there are other measures that could be used in the future if the situation required it. Nobody wants this to happen. Yes, just as a follow-up. We're still in a pandemic, but you're saying that you spoke of the rates that are in hospitals. It's significant. But can you say right now that we are still in a pandemic, even though the virus is amongst us still? We have moved from acute pandemic to another stage of pandemic. Dr. New, perhaps you could answer in terms of defining a pandemic? Yes, I can tell you that I believe that we have moved from the acute level of pandemic. The virus is circulating still in Canada, but elsewhere in the world as well. We will have to continue to deal with and live with the virus. The virus is continuing to evolve, and we have to be ready. It's upon us to be ready. So I do believe that it is a matter of continuing with our efforts, with our surveillance within the country, and now our systems are following very closely what is happening in terms of transmission, but also with respect to what shows up in wastewater in communities within our country. We have the tools to detect if there is a resurgence of the virus or if there is an emergence of a virus that is new and of concern. Thank you, ministers. Thank you, Dr. New.
Thank you. Have a good day.
Merci.
Okay, that wraps things up from Ottawa. Just to recap, Transport Canada removing all existing travel requirements as of October 1st, 2022. That is in days.